Hello everyone, Namaste and welcome to Aditya Veda Health from Home. My name is Avni Talsania and I'm a yoga professional. Today we'll be doing a special session for diabetes. The idea behind this particular session is to use yoga and breathing so that we can activate our pancreas and allow more prana and blood to flow in the abdominal organs. This will increase the stimulation of insulin and also regulate our cortisol and blood sugar levels. So when we do that, we'll help control the diabetes, but of course with regular practice. So I encourage you to take this session and keep practicing it a few times in the week. Today, we're going to start off with some pranayama. So you can find yourselves in a seated position at the bottom of the mat. Take your palms together. Make sure you're comfortable. Relax your shoulders. Take your palms in a namaskar mudra. Take a deep breath as you close your eyes and connect with yourself. In this moment, just forget about all you were doing earlier and feel present. Centering your awareness on this moment. Take a deep inhalation and on the exhalation, together we'll chant Omkar. Feeling the tranquilizing effect of the Omkar, let the vibrations penetrate through your aura. And when you're ready, you can open your eyes. I hope you feel refreshed and ready to start the practice. We'll be doing something called Kapalabhati, which is again going to massage the abdominal organs and in turn create a detoxifying effect for all the stuck energy in our gut. This is really helpful for diabetes and just allowing the purification throughout the body. So let's give it our 100%. Take both your palms and you can start with both palms in chin mudra. You can keep your spine straight and your shoulders back. We're going to take an inhalation and after that continue to exhale successively. As we exhale, we will squeeze our stomach. It will look like this. Now there should not be any pain in any part of the body. So I would encourage you to go slowly at your own pace. And let's begin with just 30 seconds in the first round. Keep your awareness on the flapping motion in the stomach. And remember that we're exhaling forcefully so that we can expel the air and the carbon dioxide from our system through the nostrils. So focus on forceful exhalations and allow the inhalation to stay passive. Let's begin. You can keep your eyes open or closed. Inhale and begin. Exhaling. Slowing down and pause the practice. Take a few seconds with your eyes closed. Feel the effects. Calming your mind. Feeling the buzzing, energizing effect throughout the fingertips, shoulders. We're creating energy in this dynamic practice. Let's go for round 2. Inhaling. and slowing down to pause the practice. In between the rounds, we take this opportunity to sit still. Let the motion turn to stillness. Observe the clarity in your mind. And for the final round, start with a deep inhalation and begin. Slowing down. Well done, everyone. We've completed 3 rounds of Kapalbhati. I'm sure you feel the beautiful tranquilizing effect in your brain. Kapal means skull and Bhati means light. So we're going to continuously shine and radiate through our skin, our face, and feel the brain cells stimulated, as well as, of course, the abdominal effect, the purifying effect in the pancreas. So now we'll begin the second practice, starting with on all fours, coming into a tabletop position. Make sure your spine is straight and you keep your palms under your shoulders and your knees under your hips, 90 degrees on both the limbs. We're going to start with a gentle inhale as we open the spine into cow position. As we exhale, we'll round and lift the mid back into cat position. Inhale, lift the chin and the chest and the hips. Exhale, tuck the tailbone and close your chin into the chest. Feeling the opening and closing of the thoracic region, as well as the abdominal organs also getting squeezed and expanded. Allow your mind to focus on these parts of the body. Increase your awareness of what's going on inside you. With the presence of mind, we can increase the effectiveness of this practice. And slowly come back to the tabletop position. Now we'll increase the intensity, raising your right hand and the left leg off the mat. Now begin to touch the elbow in towards the knee. You can tuck your chin and exhale as you release the air from your chest. Inhale and expand the arm and the leg. Use your strength to support you in this position. And exhale, touch the elbow to the knee. Inhale, expand. Exhale, contract. Inhale, expand. Make sure you're stabilized and in alignment and you're not wobbling back and forth. So keep your foundation nice and strong. Exhale and inhale. Finally, we can switch sides, taking your left hand and your right leg. Expand as you inhale. Exhale and touch the elbow to the knee. Inhale. Try to keep the limbs parallel to the ground. Exhale. And inhale. Keep your fingers stuck to the mat. Exhale. Inhale. Squeeze your glutes and your core so that you can stay stable. Exhale. Inhale. Final round. Exhale. Inhale. And release both the arm and the leg. Sitting in Vajrasana. Take your hands behind your back. Make sure your ankles are comfortable. In case this position is injurious to your knees, then you can sit in Sukhasana with your legs crossed as well. We're going to take our hands behind the back with the left hand clasping over the right wrist. You're going to open the shoulders and the chest. Raise your head up, inhaling. Slightly arch the spine. As you exhale, you will release the air from the nostrils and compress the abdomen. Inhale. Exhale. Inhale. Exhale. Lovely. Come back to Vajrasana. Now that we know the motion, we're going to add one thing, taking both our palms into fists and pressing them onto the top of the thighs. So with our fist in this position, we're actually going to press the fist into the abdomen, which is further stimulating our abdominal organs. So that's extremely helpful for diabetics. Let's add some pressure to the same exercise as before. Starting with the opening of the chest and exhaling to squeeze your fist into. Now this is going to activate the adrenal gland as well, which regulates your hormones. Exhale, squeeze the fist into the abdomen. Inhale and exhale. Maintain this forward folded position, also called Mandukasana. And return back into Vajrasana. Well done. Now we're going to take both our palms forward and hold, pushing our shoulders down and our elbow into the mat. Take your palms in Namaskar Mudra and start to press your chest into the mat. Take your forehead and softly press it as you start to raise the hips and feel the back arch in the lower lumbar. Exhale completely. Deep inhalation and exhalation. And release both your hands forward. Return back to Vajrasana. Excellent. Now we're going to move into a standing position. Now we'll be starting with a gentle warm-up, in which is called Sukshma Vyayam. Sukshma Vyayam are loosening practices in which we will be warming up the body in preparation for some more intermediate yogasanas later on. The objective especially is to do some twisting action in which we can activate our abdominal organs, which can control our blood sugar levels and also boost our immunity, thereby preventing diabetes. Let's start with a Vakra Chala movement, in which both feet are 2 feet apart. Both your hands are equal in front of your chest. You can open your right hand to the side and twist to the right as you exhale. Then take your left hand and exhale to the left. As you come to the center, return to the normal position. Now we'll be doing this dynamically. So आपको 10 बार दोहराइए. दाएं हाथ को श्वास को छोड़िए. श्वास को लेते हुए आप बाएं हाथ को बाहर रखिए. हम शुरू करें. And return back to the center, rest your arms back, step both your feet into the center. Standing with your back upright, raise your right arm towards the sky and stretch the arm upwards. As you exhale, bend to the left side. Make sure you're feeling the twist in a straight stretch on the side of the body. Inhale, raise your arm, switch to the left side. Completely raise your arm up and bend to the side as you exhale. Make sure you relax your mind and focus 100% on the movement, giving your mind, coming to the present moment, focusing on one activity at a time, which we call dharana. Inhale, straighten and relax both your arms. Let's repeat this Sukshma Vyayam called Ardha Kati Chakrasana. Make sure the chest is open. आपको छाती को खोल दो. आपका कमर को bend करिए. And raise it back up. And relax. Widen both your legs 4 feet. Take your hands to the waist. Gently open the shoulders and raise your head upwards. Starting to push your pelvis forward and create an arch in the spine. श्वास लेते हुए आपका कमर को मोड़िए. Exhale, return to the front. And completely contrast abdominal organs. Try to keep your back in a straight line if you're able to maintain the alignment of the spine. If you're able to keep a straight spine, you can move farther than that. And you can interlock both your fingers and bend completely forward. Feeling the stretch in the hamstrings, the ankles, the wrists, the shoulders, relaxing your head. Few more deep breaths. Gehri swaas. Inhale and standing up straight. Slowly rest your hands back into the center. Now you can turn both your feet outwards in a diagonal angle. Take your hands out and we're going to bend the knees and the elbows together. Aapko ghutna ko in a 90-degree angle as well as the elbows. Straighten them both out into a 5-pointed star. Bend and straighten. Bend, straighten. Exhale, inhale. Exhale, inhale. Swaas andar, swaas baar. Swaas andar, swaas baar. Swaas lijiye, swaas chhodiye. Swaas lijiye, swaas chhodiye. Keep your back straight, and for the final round, hold this final position. Taking deep breaths, feeling the strength in आपका जांघू, कमर, घुटनों, पैरों को हमारी शक्ति बढ़ा सकेंगे. Straighten out your arms and legs and relax both your hands to the sides. Wonderful job. Let's move on to the next portion, which is Surya Namaskar. Surya Namaskar is especially beneficial for diabetes because of the pace of the practice. It reduces weight and stimulates your hormones so that you can also feel a difference in your cardiovascular system as well. So this is going to make you increase your heart rate and thereby increase your immunity as well. In doing a forward fold and some of the other asanas in Surya Namaskar, we again are pressing into the pancreas and other abdominal organs. So give it your 100% and remember all the beautiful benefits of the Surya Namaskar as you complete this practice with a sense of gratitude. Pranayama, both the feet together, back is straight. Inhale, both your arms raised, kamar ko modiye. श्वास छोड़ते हुए आपको ऊपर आ जाइए, पादासन में मोड़िए. Inhale, step back, right foot, knee down, toe down, Asana Sanchalana. Exhale, step your left foot back, come into Dandasana. Relax your knees, chest and chin in Ashtanga Namaskara. Flatten the stomach into Bhujangasana. Raise both your shoulders, inhale. Exhale for Parvatasana. Both the knees and hips raise up above the mat. Step your right foot forward between both your palms, inhale. Exhale, step your left foot forward. Padasana with both your knees straight as possible. See if you can. Exhale completely. Inhale, raise both your arms up. Hasta Uttanasana, arch the back. Exhale as you return back to Pranayama and relax into Samasthiti. Observe the changes in your body for a few moments, standing in silence and stillness. Inhale, Hasta Uttanasana. Raise the arms and stretch the back. Number 3, Padastasana, bending forward. Try to keep your back as straight as possible, and if there's difficulty, you can micro bend the knees. Step your right foot back, Asasana. Left foot back into Dandasana. Both your hands up below your shoulders. Rest your knees, chest and chin in Ashtanga Namaskar. Arch the spine. Flatten the stomach. Bhujangasana. Open the chest and roll your shoulders back. Finally opening the chin. Exhale for Parvatasana. Both the heels pressing down as much as possible. Feel the opening in the chest and shoulders as we press into the palms. Right foot comes forward for Asvasanchana. 90-degree angle in the knee. Inhale. Step your left foot forward. Inhale, raise back up. Hastottanasana followed by Pranayama. Take a moment to collect yourself, focusing on your breath, letting the mind dissolve, the thoughts dissolve, feeling the energy which you created in this Surya Namaskar, heating up your body, making you feel connected with your own energy. Release your hands out to the side. We will now begin the sequence specifically for diabetes. We will start with a dynamic practice of bringing our arms up and down in a sweeping motion. Both your feet are hip-width distance apart. We're going to raise our arms up, let them be loose, but stretch them up towards the sky. Then sweep them down behind our back. Inhale, raise them up. Exhale down. Inhale up. Exhale down. Inhale up. Exhale down. Inhale up. Exhale. Inhale. Exhale. And inhale. Now relax both your hands out to the sides. Take a deep breath and pause for another moment. Wonderful job. You're going to step your right foot back. Keep both your heels in the same line and keep your back foot in a 45-degree angle. Twist your hips towards the left, raise your arms up and bend your left knee. Virabhadrasana 1, back knee straight, left knee 90-degree angle. Stretching the arms above the head, finally looking towards your fingers. The drishti, which is your gaze, is going to be towards the fingertips. Try to keep the shoulders in line with the ears. Feel the stretch of the inner, the thigh. Finally, open to warrior 2. Turning your hips out to the right. Both arms open out laterally, parallel to the floor. Take your left elbow and place it on the right, the knee, and keep this right arm above, pointing in 45-degree angle. If it's easy for you, you can keep the hand even lower down in Partial Konasana. Feel the deep stretch in the inner thighs, even in the inner hips, and sad psoas. And turn to the right side, pointing both the hips out to the right. Starting with the warrior 1. Turn to look towards the fingertips. Inhale and exhale. Focus on deep breaths with the nostrils. Should be able to hear yourself breathe. Now move into warrior 2 with a smile. Loving every moment of being here in the present. From here, we will straighten out the knee and move into Trikonasana on the same side. This is really great for stimulating our liver and pancreas with this twist movement in the stomach. Look towards the fingertips. Now we'll go even deeper into a twisted triangle. You're going to take the support of your left knee and put it down into the mat. Take your both hands into the chest and twist this left elbow outside of your right knee. Look up to the sky. Take deep breaths. You should be able to hear the ocean sound of your breathing. And slowly return to the center. Lovely job. We're going to push up by keeping both our hands down, tucking your left toe up. Raise the back leg and come into Bhujangasana. You might find that you can't bend so low, so you can raise yourself up. Take your hands towards the back, crossing your arms to hold either elbow, and then come back forward. Feel the stretch in the hamstrings. Inhale, raise yourself back. Turn both your feet to the opposite side and we will open our arms up to warrior. Then move into triangle, raising your right hand up. Look to your fingertips. Feel the stretch in your obliques. Up. You're going to generate more prana in the areas which you feel a stretch. Getting into the twisted triangle with the support of the knee down. Press both your palms together and turn your right elbow outside your left knee. Look towards the sky. Take a deep breath. Find the stillness in the challenge of the pose. Remember, the objective of yoga is not only to experience the benefits of the body, but also the meditative mind. If we can still our mind and focus on what we're doing, we can purify ourselves and feel fresh and rejuvenated. Come back into the center, release both your hands, push up the right knee and bend forward in Bhujangasana. Cross your arms towards the back, exhale. Inhale and slowly raise yourself back up to standing. Wonderful job, everyone. You might feel a little bit shortness of breath. Just take a moment, slowly collect yourself once again. Step with your feet together. Lovely. Now we're going to take a deep seated squat with both your feet hip width distance apart and your palms together in Pranayama. Coming down as low as possible into Madhasana. Some of you might be a bit higher, no problem. Wherever you are, make peace with that and find the Zen in the asana. Maybe you find that there's no Zen in this asana and a lot of pain. You should just ease it up a notch, because the definition of a yoga asana is Thiram Sukham asana. It must be Sukham. So it's okay for you to take a modified version, but perhaps you can just be comfortable in this much intensity. No ego in yoga. Wherever you are is where we honor. Moving slowly down, completely coming into Baddha Konasana, both the soles of your feet together. Press the feet down as much as you can. Relax your knees. Taking deep breaths, feel the rootedness, Muladhara chakra, the base of the spine, keeping the back straight. You can hold your knees if you need some support. Perhaps you can hold your feet if you don't need the support. Keep relaxing the muscles and giving permission for gravity to pull down the knees, open the hips. The more you're internally relaxed, the more you signal your body also to open. Deep breathing. Now we're going to cross this right leg over the left and hug the knee into the chest, getting ready for a beautiful twisting action which will detoxify all the acidity and stuck energy in our gut and abdominal organs, just as we bring about a wet cloth and we twist it and we remove the water and the dirt. In the same way, we will be twisting our organs and releasing all the toxins. Let's take the right hand up and bring it towards the back. Take your left hand, bend the elbow in front of the right knee. Inhale and ready to exhale as we release the toxins. Open the right shoulder. Maintain this position with a straight spine. Keep your palm close to your body, just below the shoulder. If you find that you'd like to close your eyes, wonderful. Invite yourself to do that. Look within. Focus within. Withdraw the outward tendencies into yourself. Become a witness to your own universe for once. Follow those signals of your body if you're receptive enough to the energy and not only to the mind. Let's now tune into our intuition. Come into the center. Lovely job. We're going to press this right knee down and we're going to rock ourselves into a gentle forward fold in the same position, seeing if we can put some pressure onto the stomach. Exhale, relax this forehead down. If it doesn't touch wherever you are, simply find the bend. Now we're going to straighten this left and switch sides. Press your right knee down and your left knee into the chest. Hug the knee to get the stretch in the glutes and the thighs. Raise the left arm up and press the hand behind your back. Raise your right arm, inhale, exhale, twist to the left. And return back to the center. Once again, dropping the knee wherever comfortable. Perhaps they're completely stacked one above the other, both knees. If not, let them be loose and simply walk the fingers forward, compressing the stomach down as you find comfortable. Slowly raise yourself back up. Straighten out both the legs into Dandasana. We're going to be doing a dynamic movement, which I like to call rowing the boat, where you raise both your hands and press them forward into Paschimottanasana, but we won't stay there. We'll take our hands in a fist, pull them back and come into a clockwise rotation. As if we're rolling the boat, forcefully push the body forward using momentum to go farther. Feel the stretch in your hamstrings. Notice how we're compressing our abdominal organs. And backwards. Exhale forward. Swash chodiye. Swash lijiye. Chodiye. Lijiye. Chodiye. Lijiye. And relax. Now we'll go to Bhujangasana, bringing both the hands, दोनों हाथ को दाएं तरफ, छाती को press करना नीचे. See if you can press your forehead all the way to the bottom and switch sides. बाएं तरफ को दोनों हाथों को मैट पर नीचे चिपकाना. Now I will repeat this in a dynamic fashion. 10 बार दोहराइए. 3, 4, 5, 6, 7, 8, 9, and 10. Excellent job. We're going to lie down on the back and turn towards our stomach in a supine prone position now. Now we're going to bring both our hands underneath our shoulders and move into upward dog by pressing a palm into the mat, extending our chest, feeling our tips of the toes lift up the rest of the body off the mat completely. Thighs, जांघों, घुटनों, कमर सब ऊपर करेंगे. And then move into downward dog by lifting up the hips. Exhale. Once again, upward dog, downward dog. Adho Mukha Svanasana, Urdhva Mukha Svanasana, Adho Mukha Svanasana, Urdhva Mukha Svanasana. Now rest down onto this chest. Press both your feet into the glutes. Take a few moments to feel the deep stretch in the quadriceps. Finally, gripping onto the ankles, raise your chest up into the Dhanurasana as you try to balance on the stomach. Open the chest, raise your knees, drive them towards the sky, inhale. Balance for a few more moments. And slowly return back. We'll be doing the Dhanurasana swinging in the next round, so take a few short breaks while we catch our breath once again. And then we get ready to come up, gripping the ankles, inhale, and this time pushing the body forward and back, distributing the weight, letting the head fall forward, then pushing more into the knees, pushing your palms into the feet so that you can swing the body backwards, letting go of the feet, letting your fall forward, back and forward. And relax. Hugging the earth, open your arms wide. Straighten your right leg and twist it towards the left. Let the foot touch the ground. Turn your head to the right side. Switch to the other side. Left foot raises across it and press your left foot down. And then turn to the center. Lovely job. And we're going to turn on to our back and go into Viparit Karni. This is a beautiful inversion for beginners in which the blood can start to flow towards the head, chest, and the throat, that way increasing your respiratory system functioning, letting the prana oxygenate your lungs, your heart, your brain, your thyroid gland, which in turn boosts your immunity. And immunity can also help you prevent diabetes, because that is the way all systems interfunction. So just absorb the energy flow coming into the brain. Relax. Both your feet come forward, and if you can push your hips up into Halasana, give it a try. We're really compressing our chest now, stomach, going for a tight squeeze. Try to see if you can keep your knees straight, interlock your fingers behind the back. For a few seconds, return your hips back down and move once again With your feet down, come into Supta Baddha Konasana with both the feet together. Open your arms wide. Start to feel the stillness take over. Deep breaths. Feel the tingling in your fingers as we move into a Shavasana. Tingling in the toes. श्वास को छोड़िए, शरीर को छोड़िए, मन को छोड़िए. Let the thoughts come and go. Simply observe. Relax your feet. Relax your ankles. घुटनों को ढीला कर दिए. जांघों को ढीला करिए. Relax your hips. बहुत कसरत किया है आज. हम रिलैक्सेशन को डीपली करना है. You deserve it. Relax the back, shoulders, neck, arms, wrists, fingers. Relax the cheeks, chin, nose, ears, eyes, forehead. मस्तक को ढीला कर लीजिए. If you're not already, you can straighten both your legs completely into letting go of all efforts. Let the depth of the breath be a vehicle for you to return within. Embrace the state of thoughtlessness. Allow it to humble you and teach you about joy, bliss beyond mind. When you're ready, you can slowly turn to the right side and hold the knees and return to Shavasana. Out of Shavasana, we come into Sukhasana with both palms folded into the center of the chest. We close this session with a prayer. Sarve bhavantu sukhinaha, sarve santu niramaya, sarve bhadrani pashyantu, ma kashchit dukha bhavet. Om Shanti, Shanti, Shanti. Rubbing your palms together, gently keep powerful vibrations, pressing them into your eyes, cheeks, forehead, head, neck, shoulders. Give yourself a nice hug. Bow down to the divinity within you. Namaste. Thank you so much for joining us today at Health from Home at Aditya Birla Health Insurance. I hope you enjoyed this session for diabetes. Stay happy, stay healthy, stay active, and stay safe. Have a wonderful day. Namaste.
Hi, I'm Vinita here, and welcome back to Aditya Birla Health Insurance's Health from Home weekend. We have with us today Dr. Suhas Khaire. Dr. Khaire is a reputed diabetologist and endocrinologist in Mumbai with over 11 years of experience. He currently practices at Zen Multi-Speciality Hospital in Chembur. Welcome, Dr. Suhas. Also today we have another special guest with us, Nikita Machado, a health coach at Aditya Birla Health Insurance. The health coaches help customers with chronic conditions like diabetes, high blood pressure, high cholesterol, and asthma. They help us to manage the lives of chronic patients better and guide them to a healthy living. There are quite a few sacrifices that diabetics have to make. One thing that I clearly saw with my family members in the festive season is that they always kept saying no to whatever sweets, even though they loved them. But today, Dr. Suhas and Dr. Nikita are here to tell us how to manage your diabetes better and turn your no to a yes. So welcome, Dr. Suhas and Dr. Nikita. Okay, here are a few questions that our readers have shared with us and also our Health from Home viewers. So I'm going to ask you quick questions where I think, you'll be able to demyth everything around diabetes. Okay, what are the few things, Dr. Suhas, that you would recommend for diabetics to keep in mind?
Thank you for kind introduction, Vinita. So, when diabetic patients come to us, they usually have a lot of things they should keep in mind. First, most important thing they should keep in mind that what they should eat, because what we usually tell to the patient, mindful eating, that is very important. Second thing, I will ask them, they should know the symptoms of hypoglycemia, that is reduction in the blood sugar level, and they should carry something sweet with them, so if need arises, they can use it. Third thing, they should know their target blood sugars, and they should always try to keep that in the check.
But then they always say, right, that, if you are a diabetic, you should never be eating sweet. And then you're recommending us to keep something sweet along with us in our bags. How does that go together?
So, most of the patients of diabetes, they are on the medication, like on the tablets or the insulin. So these are the drugs, they decrease the blood sugar less than what is required. So that's why we say they can go into the hypoglycemia when blood sugar goes below 70 milligram per deciliter. Then they feel a lot of symptoms of hypoglycemia, dizziness. They may have a fall. They may have a lot of sweating. So this is an emergency situation, and at that time they should carry some sweet along with them. So this is a necessary on those patients who are on treatment with medication or on insulin.
Okay, that's how. So I think that's an important tip for all our viewers, that always carry something sweet whenever you're traveling or when you're out of the house, when something sweet is not easily available. But Dr. Suhas, we also always hear from everyone that, don't do this in diabetes, don't do this, or, these are the things which are recommended. Of course, in the Indian society, we have so many of our neighbors and relatives always recommending things to us. So what are the common myths that everybody face in this, particular disease?
Yeah, so just like diabetes is so common, the myths are that common only. Okay. So there are a lot of myths. I encounter a lot of patients who come to me. So most important myth is initially when patients come to me, they feel why the screening is required. And I may not require any screening, because it is less likely I will have any diabetes because I don't have any symptoms. But when we check the patient and they get detected with diabetes, their blood sugar, most of the times they are very high, like more than 200, 300, and they don't have any symptoms. So we come across these patients also, they feel why the treatment is necessary, because I don't have any symptoms. Why do I treat these numbers, right? But these are very important to prevent the long-term complication, to manage their diabetes. This is a very common myth. They don't want to take a treatment because they don't have symptoms. The common myth they have, usually they feel, suppose patient comes to me, okay, and we ask the history, like, do you taking the sugar, or have you completely stopped the sugar? They say, yes, I have completely stopped the sugar, doc. So I ask them, what do you take in the tea, coffee? They say, I am taking jaggery or good.
Okay.
So I will tell
home remedies.
all the viewers that this is the misconception. Jaggery or good is not healthy. It is as bad as your sugar. So be aware using jaggery and good instead of the sugar. So they use a replacement for the sugar, jaggery. So this is also a common myth. Then some of the patient, they feel, we usually ask the patient who was on the treatment with tablets or insulin to keep check the sugar regularly, but with the glucometers, like they are the glucometers and they are fairly accurate, but they tell and they come after a few days on follow-up and they have not checked any sugars at home, and they will tell us the reason that they are not accurate, glucometers are not accurate. But this is also a myth. Most of the glucometers, they are fairly accurate. Only 10 to 15% coefficient of variation is there. CV, they are standardized. And when the sugar level is high, like 400, and they can read like 350, 360 or 420. So that doesn't make much difference. Okay, we need to treat them. So that gives us a fair idea, these glucometers also. So these are the common myths usually I came across. There are a lot of myths, but I have just...
these are the most common ones.
Yeah.
Yeah. But then, so it's always advisable to carry a glucometer also with you or keep one at home.
Yeah. I feel glucometers, self-monitoring of blood glucose is crucial in the management of the patient of diabetes. They can check their blood sugars, where they are going and how their sugars are behaving. And these numbers are very important for the prevention of long-term complication, and they can check. This is the education in diabetes, what we usually give to our patient in the first visit only.
Absolutely. And so, doctor, now during this pandemic, of course, because most of the parks and most of the outdoor areas were closed, and also all of us were in lockdown at home. So what is the type of exercise, or what is recommended for these kind of diabetics to do at home? Because also in the monsoons you can't step out, and exercise is a crucial part for diabetes management. So how do you handle that, or what do you recommend for it?
See, in diabetes management, I feel diet and exercise plays a crucial role. Exercise has ability to decrease the insulin resistance, and it decreases blood sugar beautifully. It is very helpful, and because of this, now due to this lockdown, or we cannot go outdoors, but that should not be the excuse to the exercise in diabetic patients. What that I feel. So there are a lot of options we have. So we usually categorize the exercises, what we can do it at the home. So in aerobics, we can do cycling at home, which are stationary at home. We can do squatting, we can do stretching exercises. Then definitely we have muscle training exercises, like weight training exercises. They are very helpful for the muscle strength of the diabetes patient. They are prone for the myopathies, so they need a good muscle strength. So these are the good exercises. Then why we are forgetting the yoga? So this is the very simple, common we can do at home, and yoga has shown a lot of benefits in the reduction of the stress, and it also decreases blood sugar beautifully and gets it in control.
Correct. That's actually another reason why, during the pandemic, we launched our Health from Home series, where, most of our customers were not able to, go out, step out and do their workouts. And we wanted them to continue living a healthy life. So we started this Health from Home series where you could work out at home. So it was different types of exercises, like you said, yoga, stretching, cardio, multiple types. So I think, yes, that's a very beneficial way of exercising and keeping healthy. So yeah, so thank you, Dr. Suhas, for those wonderful tips on how to keep healthy from home. So over to you, Dr. Nikita. I mean, we would like, you to tell us, since you've been, helping all our chronic management patients with, exercise tips and nutrition tips. So how do you manage, help them manage their diabetes during this particular pandemic and always?
So, thanks, Vinita. So, like Dr. Suhas said, nutrition and exercise is very important in managing diabetes. So, during our call, the first call that we make, also we educate our customers on diabetes and what actually their sugar levels mean if they are not controlled. We emphasize more on the importance of taking their medications regularly, self monitoring with glucometer at home, discuss with them regarding their medical reports, and inform them if something needs improvement or they have improved. Similarly, in terms of exercise, also we encourage them like to at least exercise 30 minutes 5 days a week, no matter whatever it is, like either doing yoga or strength training, or even as simple as going for brisk walks. So these small steps helps them improve their lifestyle.
Because I think what I have observed of people around who I've seen having diabetes, most of the time a diabetic goes to a doctor and then suddenly goes for his or her next appointment. So that period in between, maybe it's a month, maybe 3 months, is extremely crucial. And I think that's where the health coach program that you just mentioned about comes in to be very useful, because you handhold them at every interval about what they should eat and how they should exercise. I think that's extremely important for our viewers as well. So, Dr. Suhas, another question now to you.
Yeah.
One of our viewers wants to know, can diabetes be cured? And if not completely cured, can it be managed for life?
A lot of studies has been done where they have studied really a diabetes is a reversible or not, right? Or it can get cured or not. So if a lot of studies they have shown, if we significantly reduce your weight, there are few cases of diabetes that can get reversed, or we can say that can go into the remission. So that we have seen in the bariatric surgery patients also. When the patients undergo bariatric surgery, and up to in some procedures 50 to 70% of the people they are becoming normal, or they go into the remission from the diabetes. Okay, so that is real, but this number is not very huge. So this is small number of percentage of patient they can go into the remission, or we can say, better word I will use, remission than cure completely. So they can go in the remission, even though if the patient, apart from that, if the patient is not going into the remission or cure, definitely we can manage this diabetes with diet, exercise, regular medication, and screening of the complication with very minimum medication if the patient follows a better diet and better exercise. That's it.
So, Dr. Nikita, on the points that Dr. Suhas has spoken, how would you like to tell us, or would you like to tell us, I should rather say, about all the interventions that you and your health coach team does with all our chronic management patients?
So basically, we try to reach out, to our diabetic patients once every 2 months, follow up with them regularly on their compliance with medications, and whether they are physically active. If not, then tell them to at least start off, because of course there are many customers who do not exercise. So we try to motivate them and ask them to at least start for 15 minutes and then gradually increase. Check on them how they're feeling after a week or two, to see if we could modify their activity, or even in terms of diet, like if there is something, basically gauge what they're eating on a day-to-day basis and see if we can tweak anything in that and help them out.
Do they maintain a food diary or something like that? Or do they message you, or how do you keep a track? Because eating is something which is very difficult to manage, and if you see something interesting, you kind of just want to pop it up.
So usually they message us. We do have, in-house dietitians who, do provide them with the tailor-made diet plans according to, their daily routine. So
Wow.
we ask them to follow it like for 2 weeks and go back to them again to check, whether how they're feeling after following the diet plan, or do they need any more adjustments with it.
So that's also regularly managed and regularly observed, and changes are made accordingly. Okay, so Dr. Suhas, and next question is to you.
Yeah.
Do the diabetics have to say goodbye to sugar forever? Because it's extremely difficult, right? To give up on ice creams and cakes, and especially sugar in the chai and coffee. So, what is it? What is recommended for them? Is the sugar free recommended, or is it regular sugar but in lesser quantity recommended, or no sugar at all?
So, sugar, if we see complete banning of the sugar should not always, it should not be the way in treating diabetes. What we always say, the moderation is the key. In any patient, when we are treating the diabetes, what happens, we more focus on the calorie count of the patient, what they are eating, and that's why I mention what is the mindful eating. They should know what they are eating and what quantity they are eating. So we are more focused on the calories and the portion size of the food what they are eating. Okay, so if we can manage the carbohydrates, so your question was about the sugar, right? So
Correct.
sugars can be two types. One is the complex carbs, and if we classify, and second is the simple sugars. So definitely, to understand this question, I will bring some pathophysiology in this. So what happens in exactly in diabetes, the patient cannot handle the sugar what he is eating. Okay, so that's why his blood sugar increases. In simple terms, I am telling. So that when he is eating complex carbs, the sugar increases, or rise in the sugar is a little slow. But when he eats a simple sugar like sugar, the rise in the sugar is very fast. So we need a moderation. Most important, we should count the calories, and individualized diet plan is also important for that. And I always tell my patients, okay, like suppose you are going to the birthday party, and you have that craving, and everyone is eating the cake, and what to do in that instance? You are diabetic. So you are told by your doctor, don't eat any sweets, cakes, and ice creams, right? So what I tell, make a 4 part of one piece, distribute to the 3 others, and you take 1 part, like 1/4 you can have it. So that's how you can do, and you can enjoy these little moments of life also.
Correct. You're not completely asking them to stop it, because it's very difficult. And also, then, you always feel, why just me? And you feel even more sad.
Yeah, definitely it impacts on his mental health, and a lot of stress comes in when we actually ban everything to the patient. They feel, why me? Everyone is in the family, they get bombarded by everyone, don't eat this, don't eat this. That's how it goes.
Correct. Yeah. So, Dr. Nikita, while doctor said that, nutrition plays a very important role, and you also said in, the previous question when I asked you, you said that you share these personalized diet plans. We have an in-house nutritionist. So just wanted a little more elaboration on that. Does this nutritionist talk to each of the patient individually and make a customized plan for them, or is it the sugar level that determines what they should eat and what they should not? Because I'm sure most of our viewers would want to know what is the right kind of food and nutrition for diabetes.
Right. So, like Dr. Suhas did say, we know that diet plays a very important role in managing diabetes. And since we have customers across different states, our in-house dietitians, they provide tailor-made diet plans, basis their daily activity levels, basis their, medication doses, to balance their macro and micronutrients. So these diets are easy to follow, and it can be easily prepared at home. We try to focus more on home cooked meals rather than packaged foods.
Okay. So is there any particular food that you completely tell them to avoid, or that again is a customized bit for each of them?
It's a customized bit. It's basically a balanced diet, because like Dr. Suhas said, it's, you can't avoid sugar completely or avoid carbs completely. It is a low to moderate carb diet.
Correct. So, Dr. Suhas, the next question is to you.
Yeah.
So most of the patients, when say, suppose you detected with diabetes or you detected with cancer, the first thing which comes to the mind is why me?
Yeah.
Okay. So, of course, physically it's taking a toll on the body. Like physically taking a toll, even your mental health kind of goes for a toss. So, how do you typically deal with patients who have mental issues, who go into depression because they come to know that they have a disease? Is it how you handle it, or do you recommend them to go to a consultant or a psychologist? How is all this, correlated and handled together?
So let me put this like this. Okay, so what happens in India and over everywhere? So mental health is always neglected in diabetic patient in their management. So every physician who is treating the diabetes, this is very important part actually. If we see in the patient life of diabetic patient mental health, but it is always neglected because it starts from this diagnosis of diabetes. Once you get diagnosed with diabetes, it itself is a very stressful condition. Second, they have to do self monitoring of blood glucose. They have to give time from their schedule. They have to bear expenses. So everything comes as and it is a chronic condition. It is chronic lifetime usually a condition. So they have to pay a lot for very simple score we usually see, and it is very common distress in lot of patient. We see 60 to 70% of the patient, they have that increased distress score. Even if we see the psychiatric condition, they are very closely associated with diabetes. If you see the depression and diabetes has the bidirectional association. So when the patient is having diabetes, they are very more prone for depression. They may coexist. There could be eating disorders, other psychiatric disorders like psychotic disorders that also can have in these patients. So we suspect this. If we suspect these conditions, there are standardized scores for depression score. And if I feel they need a psychiatrist evaluation, I will definitely refer them to the specialty for the evaluation and their management.
Nikita, you also would be coming across certain cases when you're managing our chronic patients. So, is there, something about mental health that we take care of in our chronic management program, and how do we assist them?
So there are, some customers who do find it challenging to manage their diabetes, either because of either their erratic work schedule or, emotionally disturbed because of varied reasons. This, of course, affects their sugar levels. So as a health coach, of course, we hear them out, guide them like together, like we try to find ways that, could help them de-stress or to cope up with their stress. If needed, we even speak to their family members.
Okay, but then have you come across a lot of cases like these, or it's not too common yet?
No, there are a lot of cases where, people are struggling with different things. And now because of this pandemic, there's another added stress altogether. So I think during this pandemic phase, we did come across, some customers who were worried about various things and were sharing it as well. So as much as we could help them out, we, counseled them.
So, do you encourage your patients to regularly visit a counselor or a psychologist, or in-house counseling most of the time helps?
We definitely, after we speak to them, and if we think that they really require, we do encourage them to see a counselor, to help them out even more.
Okay. And how often do you recommend them to visit their diabetologist?
Yeah. So, Vinita, basically we tell them that once every 6 months they should go and visit their diabetologist, because then again we see customers who say कि हाँ मेरा sugar normal है, because they're checking at home, and it, years together they just continue with the same medications without going and following up with the doctor, not knowing what their sugar levels actually mean. So we tell them once in 6 months that they should actually go and see their doctor.
Over to you, Dr. Suhas. What are the early signs of diabetes that you see in patients? Because what I vaguely know and what I've read is there is type 1 and type 2 diabetes. So our viewers today would want to know, how are they both different, and what are the early signs that people should kind of be aware of? And if any of the early signs are observed, when is it that they should visit a doctor?
So this is an interesting question again. So there are two questions, subparts, I would say. One is how common is type 1 and type 2 diabetes and how we differentiate. And second, so I will answer the first question. Okay, so type 2 diabetes, usually they are usually obese. Their age is usually more than 25-30, but nowadays younger people also getting type 2 diabetes. They have very strong family history of type 2 diabetes in the mother, father, right? They are little obese, abdominal obesity is there. They have acanthosis nigricans, which is blackening due to the insulin resistance. So these are a typical phenotype of the type 2 diabetes. And type 1 diabetes, usually it is autoimmune diabetes, and usually it presents in the early childhood. Usually they are children's, but can come in the later age group also, but percentage is less in the later age group. So this is about the type 1 and type 2 diabetes. What was the next question you asked?
I think, most of our viewers would like to know that what are the early signs that they should look at, and if early signs are observed, when is the right time to go and visit a diabetologist?
Yeah, sure. So Vinita, if you see the signs and symptoms in diabetes, they are classically described as a polyuria, polydipsia, and polyphagia. So this is called as a classical triad. But it is nowadays, if you see the patient, they are present in the very small number of patients. What is described in the books or everywhere, this is classical triad. What we see commonly nowadays in the checkups, in the screening, they get detected, they don't have any symptoms. So most of the chunk, it's asymptomatic, totally asymptomatic. Up to 50 to 60% patient can be totally asymptomatic, no symptoms, and their blood sugars are very high. So here comes the importance of the screening of the patients of every patient, or maybe high risk group, or after the certain age we should screen the population also. So high risk patient screening or certain age criteria, they are very important. If you see other symptoms, so now we will go to the symptoms. So these are the asymptomatic, most of the patient. Few symptoms what we observe, like they have recurrent skin infection, they get fungal infection, right? They get urinary tract infection, recurrent infection, they get itching over the body, they can have numbness, they can have simple body pain. So anything, it is all non-specific, anything can be diabetes. So some symptoms, so definitely we should check. These are the common symptoms what I explained, but lot of they are non-specific symptom in diabetes. And the classical what is described as polyuria, polydipsia, polyphagia, it's present in a very small percentage of the people.
Okay. So Dr. Nikita, when you talk to our customers, who are typically chronic patients, do you also recommend their families to get their checkups done regularly? Because since Dr. Suhas was mentioning that most of the times, diabetes also has a very important heredity factor coming into picture. So I think it's always important for the family also to know to get their health checkups done on a regular interval.
Right. So mostly we connect with the customers itself, and if we see, they're deviating, or their sugar levels are very high and they're not taking care of it, we do try and reach out to their family members to tell them to take them for regular checkups. and also follow up with their doctors if it's been a very long time.
Okay. So, Dr. Suhas, also, I would like you to give us some tips and some of the tips to our viewers who sometimes fall on the borderline of diabetes. You know, today we hear about a lot of pre-diabetic cases. So, these borderline cases, what are the things that they should avoid to kind of fully, not fall into the diabetes scenario?
So this question is very important from the preventive aspect of this disorder, right? So a lot of patients we are seeing in the pre-diabetes range. Pre-diabetes means when their HbA1c 3-month sugar, average sugar is less than 6.5, but it is more than 5.7. So normal is less than 5.7 HbA1c. So this is a very good window of opportunity. What we say in the pre-diabetes stage. And DPP trial has shown that diabetes prevention trial that when the lifestyle modification and diet, if we do these both things like 150 minutes of the workout in a week, at least 5 days a week, and diabetic diet, a lot of diabetic patients, they go back to the normal. Lot of drugs also has been studied like metformin, acarbose, and other drugs, but none has showed lot of promise in preventing the progression of pre-diabetes to diabetes. So most important, I feel diet and exercise intervention is very important to prevent the pre-diabetes going into the diabetes and avoiding the further complication.
Okay. So, Dr. Nikita, would you like to tell us, how you tell our healthcare patients to kind of, manage their diabetes better and, control their sugar levels on a day-to-day basis? Because I think most of the patients here on the healthcare side would be diabetics, but, sometimes when they manage their sugars better and they come to a little lesser sugar levels, not to fall back into that diabetes kind of a scenario.
So actually, to add on, Vinita, we also have pre-diabetic patients, who we manage. We have a dedicated lifestyle coach who basically guides these pre-diabetic customers as well, on choosing the right foods by, tweaking their diet or embracing regular exercise, making those small changes in their daily routine.
Very important.
Yeah, like, even getting that 8 hours of sleep or, how to manage their stress. So these small changes in their lifestyle, would help improve their sugar levels, in the long run also.
Correct. Yeah. Also, now to you, Dr. Suhas, they always say that, foot care is extremely important. I was in one of the hospitals and I saw some special name, which I, now I'm not able to recollect, but a special name for this diabetes doctor who just takes care of the feet. So why is foot care so important in diabetes, and how is it that people should take care of their feet even at home?
If I say the foot care, food is the most important part in in the diabetes care. Because what happens, there are a lot of problems that and lot of amputations, what is called as non-traumatic amputation, that has been happening due to this diabetes and its complications. So I will again bring some pathophysiology here also. So what happens in diabetes, there is a neuropathy. So there is a dysfunction of our nervous system where there could be autonomic neuropathy where patient foot it becomes dry. So it is prone for the dryness, then fissures, then ulcer formation. Second theory is it could be due to loss of sensation. They are more prone for the injuries. They did not notice injuries they are happening to their foot, and they are more prone for the ulcer. Sometimes there is a muscle imbalance also in the small muscles of the foot, and there is increase in the pressure in the foot, and it again prone for the deformities, and that's why the ulcers. So diabetic foot can be a lot of types of ulcer, and in tropical countries we have seen different types of ulcer according to epidemiology. So we have seen neuropathic ulcer, vascular ulcers, and all these diabetic foot problems. They are very common, and it needs a lot of time months requires to heal this diabetic foot, and there are special foot surgeons in our country also to manage these patients. So what I was telling, so what I tell to my patient, we usually teach our patient to usually daily when they take a bath in the morning, they should examine their foot with the mirror. Is there any injuries? Is there anything, a trauma to their foot? So they can, the further complication, further wound formation can be avoided. It's a very good practice, and usually we teach this to our patients.
Correct. So do you want to say that only the foot is susceptible to all these injuries, or other organs of the body also get equally harmed by diabetes? And is there a way to, of course, take care of other organs of the body?
Definitely. So, diabetes is a chronic systemic disease. What we say systemic disease, that means each and every organ system of the body is affected. Broadly, if we try to classify this into we will usually classify into the microvascular complication and macrovascular complication. Microvascular means the small vessels of the body. So where usually we see the eye problem, where there could be a retinopathy, then there is nephropathy, and there is a polyneuropathy. So these are the microvascular complication. If we look at the macrovascular complication of diabetes, they are usually related to their heart. Like there could be a myocardial infarction, congestive cardiac failure, there could be a strokes in the brain. So these are the macrovascular and peripheral vascular disease. What I mentioned, there could be a diabetic foot. So all these are the macrovascular complication. Even we see other organ system, like we have a gastrointestinal system where they can have recurrent diarrhea, recurrent constipation. These are some problems. Some have urinary complaints like urgency, frequency, recurrent urinary tract infection. They are more prone for the infection. And we have seen now in the COVID era, diabetes are more prone for the complication of infection because of their lower immunity itself. They have less cellular immunity in their body, so they are more prone for the infection. They are more prone for the recurrent skin infection. So overall, this is called as immunosuppressive state diabetes. So I have explained, I think, everything: micro, macro, and all other infections.
Correct. Absolutely, doctor. So Dr. Nikita, over to you. Like doctor said that, some of the other organs of the body also are equally at, risk. So how do we manage this with our chronic patients? It can be an ophthalmologist, it could be a dental issue, it could be a neurological issue with a numbness. So how do we manage this with our patients?
So like we do our regular follow-ups with the customers, we try to gauge if they have or ask them if they have any symptoms, any new, something new that they have noticed. And so like I said previously, firstly, we educate them about diabetes, and if it's not controlled, how it would affect, the other organs. And we always encourage our customers to follow up with an ophthalmologist at least once a year. If they sense any numbness or tingling, to follow up with their regular doctors, if required, to follow up with a neurologist. So depending on how their situation or their condition is, we usually ask them to follow accordingly.
I think we are managing them at every interval, which is extremely important. And that leaves you with one of the last questions, Dr. Suhas, from our viewers. How important is health insurance for diabetes, and whether it is necessary to have health insurance, since you also said that it's an expensive treatment, and treatment could be required at multiple interventions and for multiple organs. If you could briefly tell us about the importance of health insurance for diabetes.
I think I have answered this question previously in the lot of questions intermittently also, but I will again tell you. So again, diabetes is what I explained. It is a chronic systemic disease we have a lot of complications. So I will tell this is some acute complication, like patient, they are more prone for the infection like pneumonitis. Sometimes they have recurrent urinary tract infection, and that urinary tract infections are really bad in diabetics. They can land up into the pyelonephritis, cortical renal sclerosis, and it requires admission, IV antibiotics in the hospital. They are not able to manage on the OPD basis these patients. These are about the infection. So there are multiple admissions in the hospital, right? Second, there are macrovascular complication, what I explained, related to your heart. There could be myocardial infarction, there could be ischemic heart disease, strokes. So these are all condition where they require a hospital admission, which is long term. They lot of expenses are there. So definitely, if the cover is there, insurance cover is there, they can get protected, and they can save the expenses.
Yeah, sure, Dr. Suhas. Dr. Nikita, over to you. We wanted to quickly know how our chronic management program at Aditya Birla Health Insurance covers some of the key features which are very important for a diabetic.
So our chronic management program basically gives a day one cover of customers with diabetes. It covers their OPD charges, doctor consultation, medicines and diagnostic tests, and they get a personalized health coach.
Oh, absolutely. That's, I think, one of the best features. And, you don't have to wait. It's a coverage from day one, and even the OPD charges are covered, and your diagnostic tests, which are also very important in diabetes. So I think thank you very much, Dr. Suhas and Dr. Nikita, for this informative session on diabetes. I'm sure our customers as well as our viewers today will make the changes that they are required to in their lifestyle, basically because diabetes is said to be a lifestyle disease, and make this change from a no to yes. Thank you, everyone. Thanks our viewers for watching this Health from Home series.
Thank you very much.
Thank you, Anita.